Vanessa Sivadge, thanks for joining me. A lot going on in your life right now.
Thank you so much for having me and for sharing my story.
Look, you are a registered nurse, a healer. Why did you decide that would be your life work?
I was born and raised in Houston, Texas. I'm a Texas girl. Throughout my high school journey, I volunteered many times at local hospitals. And so that was really instrumental in my decision to go into nursing. And so graduated from, nursing school here in Houston in 2015. And soon after accepted what I thought would be my dream job at Texas Children's Hospital in 2018. And the bulk of my training was spent in the cardiology department, actually, where I was privileged to learn from and work with some of the best cardiologists in the world. And in that department, we would take children who were struggling to survive due to congenital heart defects. And we would take this sick baby and through a series of surgical interventions would optimize their life. And so we would take sick children and make them well. And I contrast that with my role in the pediatric endocrinology multi-specialty clinic, where we would take completely healthy children and we would make them sick and we would make them medical patients for life. And so those are the two contrasts that I was seeing in my nursing career.
That must have been troubling for someone who got into the business of healing to actually heal.
This provider would prescribe cross-sex hormones at regular visits to healthy minors, to healthy children who were very confused about their sex. And he would affirm the false identities they had adopted. And in my view, he would convince parents that this was the absolute best course of treatment for their confused child. And it's a very interesting thing when a parent is in a clinic room and hears from a doctor in a white lab coat with many, many degrees on the wall that this initiating their child down a path of medical transition into the opposite sex is going to save their life. For many parents who are well-intentioned and well-meaning, they buy into this. They truly believe that this is going to help their child. And so I saw that happening in my workplace. And I knew that I had to come forward to say something about that, because not only are many of these children confused about their sex, but many of them have associated diagnoses. Many of them are autistic. Many of them are depressed and anxious. Many of them have been to the ER with previous attempts of self-harm or suicide. And I saw this trend and this pattern, and that was heartbreaking for me as a nurse and as someone who I'm so privileged to care for the patients that I serve. And it was just really troubling to see all of these issues kind of cast aside in the name of prescribing a hormone. And that was the priority.
You were not alone. It turns out Dr. Ethan Heim was seeing evidence of the same thing that you just described. What was your reaction when Dr. Heim provided evidence that TCH was illegally continuing transgender health care on minors in violation of Texas law?
You know, Dr. Heim is a hero. And at the time, I had no idea who he was. He was an anonymous whistleblower who came forward in May of 2023. He worked with journalist Christopher Rufo and exposed the existence of a secret transgender program. And I say secret because Texas Children's Hospital went to great lengths to conceal the existence of this program from the public. It was scrubbed from their website. It was hidden from parents and lawmakers for a very specific reason. They knew that the Texas Attorney General had issued a statement in condemnation of gender-affirming care that it could be investigated as child abuse. So Texas Children's, to shield themselves from liability, made multiple statements stating that this program was not happening, that they were not providing hormones to minors, unequivocally condemning the existence of this program. But it was all a lie. And so an anonymous whistleblower who we now know as Dr. Heim came forward, exposed that. And I read that report at work one day, and I said, this is absolutely true. This is happening. So I knew I had to come forward to affirm that, and that's exactly what I did. I worked with Christopher Rufo once again. I anonymously provided a testimony affirming what had already been reported as true.
Once Dr. Heim had come out, you were at something of a crossroads. You could stand back and say, hey, look, the word's out, or you could become involved in the whistleblowing process. Why did you decide to take what many people see as a very principled stand with consequences?
Ultimately, this is about saving the lives of children. Ultimately, this is about setting a precedent for other whistleblowers who are working in a hostile environment where they're also seeing illegal things or maybe suspicious things happening in their workplaces. It's about setting a precedent so that other people of faith, especially in my case, I'm an evangelical Christian, and that played a huge role in my decision to come forward to expose this. I just remember reading a verse in Ephesians 5, and it says, have nothing to do with the worthless deeds of evil and darkness, but instead expose them, and that everything exposed by the light becomes visible. So that was the impetus and the catalyst to me deciding to speak out, and at the time it was anonymous. No one knew my identity, and I knew that that was the right thing to do.
In addition to Dr. Heim's revelations, you have uncovered what you believe to be fraud against the American taxpayer. Can you talk about that?
Absolutely. Well, backing up a little bit, last July in 2023, after I had come forward anonymously, I went back to work, and 2 months later, I get a knock on my front door. And having dinner with my husband, with friends, we were enjoying ourselves, and go to the front door to see who it is. And lo and behold, there are 2 federal agents at my door asking to speak with me about issues at my work. And they flashed their badges. They said they're from the FBI and that they've come to my home because they know of my views against transgender medicine. And not only that, but they said I was a person of interest in an investigation targeting a whistleblower who had allegedly released patient confidential information and violated HIPAA. And of course, they were referring to Dr. Heim, who at the time was anonymous. But besides that, I heard what these gentlemen were saying to me, and I knew that they were lying because there was absolutely zero patient information that was revealed to the public. It was all redacted. And I knew that they were on a mission to coerce me into helping their investigation, to reveal Dr. Heim's identity to the world, and they thought that they could intimidate me into helping them. And so it was in that moment when 2 federal agents are standing at my door, and I have a decision to make. Like you said, I'm at a crossroads. And my faith is the cornerstone for everything that I've said and done. And I believe that men and women are created biologically distinct with a unique purpose. My faith tells me that, but beyond my faith telling me that, that's just science. Following the science has to mean something. We have to uphold biological truth in medicine. Otherwise, children are harmed.
When we talk about Texas Children's continuation of this transgender health care in violation of dictates by the Texas Attorney General as well as the state legislature, what were you able to determine regarding how they were doing that, and in a sense prescribing to minors cross-sex hormones and hormone blockers and using the Medicaid program to pay for it?
Yeah, so over the last several months, to answer your question, I uncovered, I uncovered evidence that proving that Texas Children's is using Medicaid to cover cross-sex hormones for minors. And not only are they utilizing American tax dollars to pay for puberty blockers and hormonal treatments, but these providers, these transgender medicine providers, were also misdiagnosing patients on purpose. And the reason that they would do this is in order to justify the prescription of those cross-sex hormones in order for the insurance to cover it. So they would intentionally misdiagnose, let's say, a 16-year-old male with an estrogen deficiency as the official medical diagnosis on the chart. And then that would then justify the providers, prescribing estrogen for a male confused about their sex. And so I uncovered those two kinds of fraud. Both of them are illegal. Using Medicaid to pay for anything related to gender-affirming care and cross-sex hormones is against the Texas Medicaid policy, and that's fraud.
Have you been approached by federal investigators to talk about those allegations?
I went public on June 18th with journalist Christopher Rufo to essentially come forward to blow the whistle on what Texas Children's was doing in using American Texan taxpayer dollars to pay for treatments that will cause irreversible harm and lead a child to a path of a lifetime of regret. I think that there are so many side effects, both mentally, psychologically, physically, that we cannot even begin to understand, and has not even come out in research studies, because this is a social contagion that has gripped this generation, and they are desperately seeking for a place to belong. Many of them are just going through a really hard time with puberty. That's a hard time for any middle schooler, going through the changes in your body, the normal expected changes. And for a doctor to advise parent and child alike that a hormone will solve their inner turmoil or their issue, whatever it may be, is egregious and horrific, and it's child abuse. And so I knew I had to come forward to expose that.
You called it your dream job, and yet you've lost your dream job. I understand that you've been terminated by Texas Children's Hospital, even though you asked them for a religious exemption. Can you talk about that process?
Absolutely. On August 16th, just a couple of days ago, I got a phone call from the hospital that I was fired effective immediately. And I believe that this is due to my blowing the whistle on the illegal actions, on the deception, and on the fraud that the hospital has taken part in. And not only that, but to add some background to my request for a religious accommodation, I submitted a request to my supervisor on May 31st, just a couple of months ago. And in this request, I expressed my regret at having played an indirect role in the care of children on puberty blockers and cross-sex hormones. And I stated that I could no longer work in an environment that promoted that. And not only that, but Texas Children's is continuing to see patients over the age of 18 with gender dysphoria. And I knew that that was going on. And not only that, but it is my belief that many of those patients over 18 are on Medicaid or a state or federal insurance like CHIP or STAR. So it is my belief that the fraud is ongoing. And so I could no longer even have an indirect part in that. So I requested a transfer, which I thought was a very reasonable request. I requested an internal transfer to a different department in the hospital. And under Title VII of the Civil Rights Act, employees are, like me, with religious beliefs, are protected from discrimination by any employer on the basis of race, sex, or religion. And despite that, the hospital chose to ignore my request. They did not act on it, and instead decided to terminate me.
I want to ask you this question. You had interaction with many of these young people who were later prescribed these powerful medicines. What do you say to their parents who are being told that their children could do harm to themselves or even take their own lives unless they agree to this course of medication?
That's such a great question. Like I said earlier, most parents love their children deeply, and they're well-intentioned and well-meaning, and they want to do the best by their child. However, there is an environment in healthcare, in the culture surrounding the white coat, that everything that the doctor says is absolutely the way to go. It is absolutely reliable and true. And unfortunately, that has led parents to accept that a hormone or a puberty blocker will save their child's life, that is life-saving. And nothing could be further from the truth. This is a highly lucrative industry. Some estimates put it at $70,000 to $80,000 per child. A lifetime of doctor's appointments, of multiple, injections and testosterone and estrogen injections per week, the labs to check those levels, the follow-up, then not to mention double mastectomies and bottom surgery. I mean, it's such a lucrative industry. And so it's my belief that many doctors in transgender medicine only see the dollar sign.
Just for the record, you have never revealed the identity of any patient in that clinic, correct?
Correct.
That will remain the case?
Absolutely.
What kind of toll has this taken on you?
It's been a very difficult week for me. I was at Texas Children's Hospital for 6 years. The bulk of my formation as a clinician and as a nurse was there. I have friends and coworkers there still. And despite all of that, I have absolutely no regrets over what I've done, over what I've said, because ultimately this is so much bigger than my getting fired from the largest children's hospital in the nation. This is about coming forward in an attempt to save children's lives, and to stop this social contagion. We need to shut it down. This needs to be the beginning of the end of gender-affirming care in America. And I'm not the only one who's come forward. There have been many courageous people that have come before me and that will come after me. And if my story can serve as an inspiration, as an example for someone else who's seen similar things, who is fearful of the consequences or of what might happen to them, whether that be the hospital's retaliation or the federal government's retaliation. In my case, I've experienced both. The risks are always worth it, because this is ultimately about saving children's lives.
The irony that two health professionals blew the whistle against an entity that they believed they had witnessed breaking Texas law to be, in one case, prosecuted, in another case, at least, harassed by federal law enforcement. What does that tell you?
Sorry, can you repeat that one more time?
Yeah,
in a different way.
Yeah. Clearly, two health professionals, you and Dr. Heim, saw Texas law being violated and blew the whistle when the hospital refused to stop. Instead of being praised and secured by that decision, the federal government, federal law enforcement, has come after Dr. Heim and may come after you. Do you see the contradiction there?
Absolutely. I think in my case, the federal government weaponized two agents from the Department of Justice, from the FBI, not to investigate the hospital committing the crime or hiding the crime, but investigating a pediatric nurse who exposed that the crime was happening in the first place. And, the FBI used to be I used to watch movies as a kid and think of the FBI as an organization protecting American interests and defending the American homeland. from terrorists, from the bad guys. But instead, that has drastically changed. And now they're going after people of faith, law-abiding citizens whose only crime is to speak the truth. And that's exactly what I've done.
There will likely be litigation surrounding your dismissal. I suspect you won't take this lying down. And in litigation, there can be transparency. Is that what you seek? And I understand that you're raising some money to try to wage that battle.
I am. I have some amazing attorneys. The Burke Law Group, Marcella Burke, and she is an amazing woman, and she is a fighter. So grateful for everything my attorneys are doing on my behalf. But I am raising money because attorneys' fees, legal fees are not cheap. And I'm just a normal person, and now I've lost my job, so I don't have the resources to fight this on my own. But I'm so grateful for the support from the public. They've just inundated me with messages of love and support and encouragement. And so I'm so grateful for the donations that I'm raising on my Give, Send, Go. And I'm just, we'll see what happens in the future.
Do you think Texas Children's Hospital wants the full truth known?
No. No, absolutely not. They've gone to great lengths to conceal the truth from the public and from lawmakers. Why would that change now?
What if they push a big number in front of you to be quiet, to go away?
Well, I don't think that is likely because they are hundreds of millions of dollars in the red at the moment. They've just laid off 1,000 people from their workforce. And although I don't rejoice at that doesn't make me happy. I think it's interesting that all of this has, my situation and situation with losing the Medicaid contract has all converged at the same time. And I just think that is, it's really interesting. That's all I'll say.
Okay. Vanessa Sivadge, I've enjoyed the conversation.
Thank you.
Thank you for being so open with me. And we will follow your journey ahead, and the transparency, the truth. That's what we as journalists are about. And we thank you for telling us your side of this very compelling story.
Thank you so much for having me.